Today on Trey Hart, we're going to talk about angioplasty. Stick around. So sometimes while the patient has gone through the procedure of angioplasty, sometimes their family or friends have questions about it. The most common question is what actually is it? And usually this is because they weren't in the actual discussion that the patient had with the doctor for the doctor to explain to the patient before they went to the procedure what it was. So today on Trey Hart, I'm going to give you a brief explanation of what angioplasty is, and hopefully you'll like it.
Angioplasty. What is it? Angioplasty is a minimally invasive procedure to widen narrow or obstructed arteries or veins. This procedure is done inside the blood vessels. Over time, a vessel may become narrow. During angioplasty, a deflated balloon attached to a catheter is passed over a guide wire into the narrowed vessel. The balloon is then inflated to a fixed size, which forces expansion of the blood vessel and the surrounding muscular wall, allowing an improved blood flow. Sometimes a stent is also placed at this time. The balloon is deflated and the catheter is removed. Fortunately, angioplasty is a low-risk procedure when compared to other options. The risks can include passage and lodging of an embolus within the bloodstream, arterial rupture, hematoma or false aneurysm formation at the access site, radiation-induced injuries from the X-ray used. Usually, recovery will be an overnight stay. The medical team will monitor your vital signs and routinely check your operation sites for signs of bleeding, infection, spasms, etc.
Okay, so that brief video just showed you an explanation of what angioplasty is. And no, I didn't cover all the complications that were possible or all the risk factors that were possible with angioplasty. Really, this is something that should be discussed with the patient and the doctor before they go. Now, one of the common questions is angioplasty for everyone? And this is one of the ones that the doctor really needs to answer with the patient if it is for that individual patient. One of the things before they do any procedures, the doctors will compare risks versus benefits. Basically, how many risks does it have and what are the benefits? And if the risks are greater than the benefits, then they typically don't even suggest it to the patient. But if the benefits are greater than the risk, then they will suggest it with the patient and go over it with the patient. Now, so it is individualized for the patient. So angioplasty isn't for everyone, and the doctors are the ones who decide which patients that they want to offer this to based upon the risk factors. So if one of the main things that if you are a patient that you discuss all the risk factors with the doctor before you have the procedure, they will discuss it with you. And if you have any questions, be sure and ask them at that time. So I hope you liked this video. If you did, please like, and if you're not a regular watcher of this channel, please subscribe. And I will see you next time.